Hi, hello. Thank you for watching today's video. I'm going to be talking with you today all about pharmacology for beginners. So I'm really excited to be back on the platform again here with Picmonic. If you don't know who I am, my name is Nurse Chioma, and I'm the founder of Choosing Nursing over at choosingnursing.net. Like I said, we're going to go over and helping you to better understand drugs, medications, right? Really helping you to better understand what this means. So I know for some of you, as you're listening to this, you may be in a position right now where you might have just started your nursing program, or you're in medical school, or you're in pharmacy school, right? Maybe you're pharmacy school, maybe you're pharmacy tech, maybe you're a physician's assistant, maybe whatever your healthcare background looks like, or if you're just curious, this is going to help you to better understand pharmacology and just giving you some resourceful tips and information so it really begins to grasp and click a lot better for you, right? So if you was to start by looking it up and looking up what exactly does the word pharmacology mean, right? What does that word really mean? And pharmacology is all about the study of drugs, essentially what it means, right? It's the study of medications, the study of drugs. And I want to help you to kind of simplify the way that you may be approaching studying and learning drugs, right? Maybe you're about to take classes on it soon, or maybe you're in classes on it right now. And I want you to think about the last time that you took some type of over-the-counter medication, right? And what was going on right before you took it? You probably had like a headache, right? Maybe you're experiencing some type of pain. And you took the medication, right? You took like Tylenol or ibuprofen, one of those common medications, right? And then you felt better after you took it. So what I want you to think about now, and in that type of situation, you're thinking about it from you as the person that is taking the medication, like you as the patient, so to speak. But now you are the healthcare professional, right? Or one day soon will be. You have to ask yourself, what pharmacology really means is that you have to ask yourself, okay, why did that drug work? What exactly went on inside of my body that caused the medication to work? That is essentially what you are learning about when it comes to drugs and medications, is why did it work? How did it work? What do I need to, what's the follow-up behind it working, or potential side effects, and et cetera, right? That's essentially what pharmacology is all about. So there are some very simple, terminology that I want to bring up with you that will better help you to understand this. And this is kind of helping you to understand the mechanism of how medications even begin to work, right? So we have the rationale of medication. So rationale is, why is the doctor ordering a medication, right? And usually it's in order to get a specific outcome. But then the mechanism is how it actually works in the body, right? That's pharmacology. So rationale is, for example, okay, we're giving the drug to help lower their blood pressure. That's the rationale. That's the ideal outcome. Versus the mechanism is that maybe this drug, it could be a ACE inhibitor, right? So then in that situation, it prevents the ACE enzymes, which causes the conversion of angiotensin 1 to angiotensin 2. Right, which promotes high blood pressure. So that's like a example of rationale versus mechanism. So going back to how the drug works, like why did the drug work? Why is it when you took the Tylenol, it did something in your body? Exactly, understanding what that really looks like or it means in simplified forms. So I want to give you some quick terminology that you should be familiar with. We have absorption, distribution, metabolism, and excretion. One more time: absorption, distribution, metabolism, and excretion. So each of those terms is the reason why it's so important as far as why we give a medication in one route over the other. Each of those terms. So let me go over really simple what each of those terms means. So absorption is, okay, when we give a patient a medication, or when a drug is ingested or it's pushed or it's given IV, however it's given, absorption is like it sounds, how it absorbs into the system, okay? So how well it begins to absorb into the system, and the speed of the speed that it absorbs is influenced by what route it's given. So this is why there's certain medications you have to be aware of the rationale, right? Because if, for example, if the rationale is to lower the patient's heart rate, and the medication needs to be given by mouth and not, like, for example, IV, then the absorption rate is going to be faster. And if the absorption rate is faster, there's a higher chance of risk, right? And so in that type of instance, because there's a higher chance of risk, they should likely be on some type of monitor, right? Cardiac monitor, they need to be watched, right? So that's what you're thinking about when you're thinking about absorption, how fast the medication is going to be absorbed into the patient's bloodstream. And so when we give medications by specific routes, by mouth, subcutaneous, IM, IV push, that's why it matters, because of how quickly it's going to absorb. And there's certain medications that, because they're more high risk, if they absorb too quickly, that's why somebody can die. That's what can cause, something terrible to happen to the patient. Did you know that the number 3 leading cause of death in the United States is medication errors? I know, isn't that crazy? And I'm not saying that to, scare you or anything like that, but I'm saying that because this is why it's so important that you really understand, drugs. Even if you're just getting started, you have an understanding of it, that, you take it seriously, and that you really begin to digest it and understand it well. So absorption, right? Then we have distribution. So now it begins to distribute throughout the body, right? And once again, it's all a matter of how it's coming into the body in the first place. But if somebody is ingesting the medication, for example, swallowing it, what typically is going to happen? They're going to chew it. So their saliva, or unless it's not a chewable drug, they'll just swallow it. They'll swallow the medication. It will go down their esophagus. It will go down their stomach. The stomach will begin to break it down with acids, right? And then it will pass through, and it will go through the small intestine. And now it'll begin to get absorbed, and it'll begin to become distributed throughout the body, right? And so if they're getting the medication by mouth, then it's going to take usually anywhere from half an hour to an hour before they begin to feel the effects of that medication, right? But if the medication is given, especially if it's given IV or IV push, which are two different things. IV would be, it's running through a continuous IV line. IV push is where you're pushing is where, a trained licensed professional is pushing the medication through the IV routes. And then as a result, it's going to work way faster. So with those type of medications, you have to give them slowly, over 2 to 5 minutes, and they need to be on a heart monitor. They need to be monitored closely, so that way some type of adverse effect does not happen, right? Such as, for example, digoxin, right? That's another reason why when we give IV push medications, we have to look at certain type of parameters or lab values before we even give it, right? So before we even push the medication, we need to look at their labs. We need to particularly look at their heart rate, right? So you have to also be aware is that when you're giving medications, there are some labs or parameters or vitals that needs to be assessed before it's given. Otherwise, it's no longer appropriate to be given, all right? So we talked about absorption, we talked about distribution, and then we also talked about metabolism. So now it's metabolizing through the system. Have you ever heard, maybe somebody has ever told you, you have a slow metabolism or you have a fast metabolism, right? I may or may not be saying this in the specific order that goes to the body. But you have metabolism. So metabolism now is where the body begins to metabolize the core ingredients, the active ingredients of that medication, right? So and that's when it begins to work in the body, right? So it begins to metabolize it. So what you want to think about now when it comes to metabolism, especially from the perspective of a healthcare professional, is who would be at risk when giving medications, who would be at risk for the medication to metabolize slowly versus the normal rate. In fact, if you already know what I'm thinking, comment below this video right now and let us know who would be at risk where it would not metabolize. For example, if I give them a medication, who would be most at risk where it would not metabolize as quickly enough? And so as a result, we have to be careful when giving it again. We have to be monitoring what type of signs and symptoms of toxicity looks like, right? So a couple of things that should be coming to mind is one, elderly patients, right? So patients that are elderly, they can have a slower metabolism because of physiological changes in their body. And because of those physiological changes, they may not metabolize certain meds as quickly, which is why we want them to get a smaller quantity or a smaller dosage. That's why there's a higher risk with elderly patients in the hospital, because they're more likely for adverse events and for many reasons, but their age and their weight, their size, right? If any chronic conditions they have. So when we look at that, we have to be aware of, with elderly patients, you have to be more careful with the amount. So for example, the doctor may order to administer Ativan, right? So let's say you have a patient that is confused, that is agitated, and there's no allergies, there's no contraindications or anything like that. And this patient is 300 pounds and they're a 40-year-old male, right? And they're very confused, agitated, they're throwing stuff. So the doctor may prescribe, yes, give them 1 milligram of Ativan, right? 1 milligram Ativan. And you'll give that 1 milligram and the patient will become more calm and relaxed. They'll still be alert, they'll still be awake, but they're way more calm, right, for the rest of the day or for the next 4 to 6 hours. Versus if you give that same amount to an elderly, oh my gosh, now there's a really higher chance of hurting them, right? They may suffer from respiratory depression, right? They may have troubles waking up. So instead of giving 1 milligram, the doctor would order, maybe 0.25 milligrams, something that's very tiny, a very small, or 0.1 ml, like something that's a very, very small dosage to administer to the patient. So these are some of the things. So when you are a healthcare professional, you have to stop and think, and you have to be aware of the patient and their biological makeup and how that influences giving them or administering them the medication. Okay, so these are some of the things you have to be thinking about. So metabolism is pretty much now the body begin to break down those active ingredients. Then after that, now that it's broken down, and at this point, the medication is working in the system, right? It's passing through. The patient should be feeling better. And then finally, we have excretion. So now, at this point, it's going through the large intestine, and it should be excreting and coming out of the body readily, right? Readily and normally. Now, here's the thing, though, going back to the example of contraindications, is what type of patients are typically slower when it comes to excreting medications? What do you think? What type of patient would likely not excrete the medication as fast, as quickly, as readily? This is going to be renal patients, patients who have chronic renal disease or chronic renal failure. Why? Right? Because think about it. What does the kidneys do? The kidneys are supposed to help to metabolize and excrete. It helps to get rid of, waste and urea. That's essentially what the functions are. It helps with fluid electrolyte balance. When somebody has a problem, though, where their kidneys are not working as well, then all of those functions are either impaired or slowed down. So because they're impaired or slowed down, they can't excrete as quickly as others. And that's why they may not, pee a lot. The urine output is low. And that's also why with these patients, they need to often be on dialysis, right? So what dialysis does is that it helps to get rid of all of those waste and toxins, all the things that your body normally excretes on your own, but with a patient that has kidney disease, they can't excrete it at the same rate, at the same pace as well. So when we think about excretion, and that goes back to the example I was telling you with the elderly person too. The reason why somebody, if you gave them 1 milligram of Ativan, an elderly person, why it would just knock them out, and it's like several hours and they're still sleepy and they still won't wake up, because same thing, their kidneys don't work the same. So they're not excreting, they're not removing the waste as quickly as they can. That's why we have to also be careful when we're giving certain types of antibiotics. So any type of medication that is like a high-risk medication, right, your high alert medications, you have to be more careful with certain patients because of the likelihood that their body won't be able to excrete it as quickly as they need to. So for example, a medication, this is not high alert, but it's a common antibiotic that's given, is vancomycin. Vancomycin is a very potent medication, very potent antibiotic that is often administered in the hospital or acute setting as an IV piggyback drug. So when we're given this IV piggyback drug, we have to do something called peak and trough or peak levels. What that means is that usually on every third or fourth dose, depending on whatever the protocol is for the hospital or the facility. So what we have to do is that we have to first check the amount of the drug in their system before we give the drug. And that prevents us from overdosing or giving too much of the medication before the patient has a chance to readily excrete it out of their system. So there are certain drugs, such as vancomycin, where we do peak and trough levels prior and ahead of time, which helps us to make sure that we don't give too much of the medication, right? And so same thing as well, we check their levels, and the levels would tell us, okay, they're not absorbing it, or they are absorbing it, or we can hold the dose, and the doctor may change the amount of vancomycin. They may go from 500 milligrams to 250 milligrams, right? Or they may change the frequency every 8 hours to every 12 hours or every 24 hours, right? Really depending on how the patient is doing and how the patient is performing. So these are some of the things. And I know that Picmonic has a great video actually inside of the portal where they go over peak and trough levels and really give you a very clear visual perspective on peak and trough, helping you better understand it. So important that you understand simple parameters, simple measurements such as that. Okay, so definitely want to check that out. So these are some of the things that we're thinking about. We're thinking about absorption. We're thinking about distribution. We're thinking about metabolism. And we're thinking about excretion. Some of the terminology that you want to familiarize yourself with when learning pharmacology. Another thing, so now here's some basic study tips behind pharmacology and studying the drugs. One of the best things you can do for yourself is to group the drugs as best as you can, put them into different groups. And what I mean by that is organizing them. Okay, these are renal drugs. These are cardiovascular drugs, right? And then further organizing them into, okay, these are beta blockers. These are fluoroquinolones. These are antibiotics. That's what I mean as far as really organizing the medications so that way you are able to comprehend it and it can really click and make a lot of sense for you. So when you're looking at drugs, here are some things that you want to study and review and be aware of. The first and number one is, like I said at the beginning, why are we giving the drug? What is the ideal rationale for giving this medication? Is it to lower the heart rate? Is it to lower the blood pressure? Is it to decrease pain, right? So what is the drug given for? Another thing you want to be aware of is also what are the side effects and what are the adverse effects? So side effects is what we would expect to happen, right? So with a side effect, the patient likely, we're not always going to stop giving the drug, all right? So side effects are usually expected effects, and we don't necessarily will have to stop the medication. The doctor may, in fact, order another drug to mitigate the side effects. Then we have adverse effects. Adverse effect is actually dangerous. Adverse effect is the patient's life is at risk and has a high mortality risk. So what you have to study is that you have to be aware of side effects versus adverse effects, because the way that we respond to one over the other is obviously different, right? If it's a side effect, then we educate the patient, make sure they understand the effect of what they're getting, but we don't necessarily stop the drug. But if it's an adverse effect and we're looking out for the signs and symptoms of that, then we have to stop giving the drug right away, immediately stop the medication, and if necessary, give them the antidote that may reverse the medication. So for example, if it's opioids, if they're on opioid medication, to reverse giving the use of opioids, we may need to give them Narcan, right? Narcan will help to completely reverse it if for whatever reason we suspect the patient is either going to hyperventilation, respiratory depression, right? They're losing consciousness, that type of stuff. So these are some things you want to think about. So we have rationale, side effects, adverse effects, and then also the therapeutic effect. Therapeutic effect. So therapeutic effect is what is the ideal effect that we want the patient to have. And that's essentially can be interchangeably used as the rationale, right? The rationale, the ideal outcome. So that's what therapeutic effect means. Another terminology you should be aware of is something called off-label drug use. Off-label drug use. What that means is that there are some medications where it's originally intended for this rationale, but we also give it for this. And it's called off-label drug use. A good example of this is Ativan or lorazepam, right? So lorazepam is normally given for anxiety. That's the ideal rationale. But the off-label use is that it can also treat seizures. So that's important to know because you have to be familiar with that there are some medications, not all, but there are some medications that do have an off-label use, which means that it has a different intended use aside from what it's normally recommended for. So these are some things that you have to be thinking about, some type of terms you have to be aware of, right, when you're studying pharm. Another thing I would recommend is to do flashcards, because honestly, drugs can feel like a lot. It can feel like a lot going through the medications. And so what I recommend is that when you are learning the drugs, especially if you have to study for like a test or something, put on one side the drug name, and then on the other side, put like the rationale and the side effects, at least one side effect and at least one adverse effect. Those are usually the most important things because, like I mentioned earlier about medication errors, right? That's the most important things for you to know for the safety of patient care. So creating flashcards, reviewing the flashcards will help you to understand it. And definitely pay attention to the route. Not every medication can be given by mouth, IV, subcutaneous, IM, IV push, right? Some medications can only be given by a certain route or routes. So being aware of the route, that is so important to the safety of the patient. So pharmacology, honestly, it is very detailed, right? You want to do it in chunks, until you really understand it well. You have to be patient with yourself, be patient with the process. It can feel daunting. Picmonic has some excellent resources that will help you to better understand the drugs and really help you to comprehend it more quickly and grasp it, so it's really, really simplified for you. Learning medications doesn't have to be hard. It can actually be very simple, but it's all about your approach. And honestly, you have to be willing to do things repetitively until it really, really makes sense until it really begins to click for you and you really comprehend the medications. So these are some simple study tips, that I want to help you with for pharmacology. I know that this can feel like a lot, but honestly, this is only the beginning. You have to, once you understand these foundational elements that I just went over, it does become easier to learn more and more medications. And then now you can better understand a drug order, right? When a drug is ordered a certain way, and if that order is appropriate or not, right? Now you can better understand things like that. So these are some of the foundational principles. Come back to this video, save this video, watch it over and over and over and over again until you actually finally really comprehend it. So that was it. I hope that you found this information beneficial. If you did, make sure you go ahead and hit the like and subscribe. Follow Picmonic right now. Make sure you subscribe. So for more awesome video teachings like this, share this video with somebody that will find it beneficial. Share it across your social media pages so that way other people can learn about this information and they can begin to understand pharmacology. All right. Once again, this is Nurse Chioma, and I hope that you found this informative, and we will see you the next time. Take care.